Hello ladies, this is a video to talk about the Leep procedure that I just had about 10 minutes ago. So a little background: I'm 23 years old, no kids. I was diagnosed with HPV about 2 or 3 months ago when I had an abnormal pap smear. So that was the first step. Abnormal pap smear, went to the gynecologist, and yeah, she told me that I had high risk HPV, and she also said that I had CIN3, which is high grade CIN3, which is kind of like the precursor into cervical cancer. So I'm just doing this video because I know before my procedure I didn't see a lot of videos about Leep procedures and the aftermath and how to cope and deal with everything. So this is kind of what I wanted to do. So let's go back to when I was they found HPV, high risk HPV, and then she scheduled me, I think 3 weeks later, to come and get a biopsy and a colposcopy. So I got that done, and that procedure was a little painful. Yeah, it was painful. It was painful. I'm not gonna lie, it wasn't the worst pain in the world, but it was still painful. Yeah. So after that, she called me in 2 weeks later and told me that that's when she had found the high grade precancerous cells on the surface of my cervix. So here I am today. She scheduled me for a Leep procedure. I know I didn't look at the procedure itself, like the surgical procedure, online, because I'm kind of freaked out by blood and gore and all of that stuff, so I refrained from doing that. But I did listen to other people's testimonies, so I kind of thought that I can just give mine. So I can just start from the beginning. I was nervous going into the surgical procedure. And even though it's a procedure, it is a surgery. So yeah, I went in. I was pretty nervous about going in. I actually had my mom with me. I had my mom with me during the procedure, and my gynecologist was receptive of that. She let me have my mom inside with me, and I'm glad she was there because I don't think I would have been able to pull through without her. But so just going into it, you go into it like a pap smear. So you lay down on the bed thingy. So you lay down, you put your legs up as if you're gonna get a pap smear. She puts the tool in you, opens you up, and she cleans the cervix, the inside of the cervix first. So after she did that, she numbed my cervix in 4 areas. So 2 on the left and 2 on the right. So she opened up the tool as far as she could and then numb me up. So the numbing part was kind of painful because it's this really long needle that she put inside of me, and it felt like a tingling sensation but pressure, if that makes any sense. So it tingled with pressure. On a scale 1 through 10, that pain, I would say maybe a 6.5, 7. So it tingled with pressure, but I was like, okay, it's gonna be numb for the rest of the time, so I should be fine. So she numbed me up, and she doesn't do them all at once, of course. So it's one needle, then the other needle. So I believe when she goes to the lower side, because it's like upper right, lower right, upper left, lower left, I believe when she went to the lower sections, that's when it kind of hurt the most. You kind of feel it in your tailbone, like in your back area a little bit. You can feel the sensation like poking at you. So yeah, so that was pretty painful. And she was, like, take deep breaths, make sure you breathe, because if you don't, you might pass out. But just make sure you take deep breaths. It does feel very uncomfortable. So make sure you take deep breaths. And yeah, so she put the needle inside. It stung a little bit, like I said, pressure and tingling. So after she did that, she explained every step of the way. So she actually turned on the machine. She said it would make a lot of noise, which it does. It makes a lot of noise. It's kind of annoying. It sounds like, I'm not sure if anyone has heard like a nebulizer, but it sounds like a nebulizer going off, and you can just hear it. So, you know, I'm getting myself prepared, and she told me that she's gonna start. So she actually started. She let the anesthesia sit for a second. I want to say for maybe like 3, 4, 5 minutes, and then that's when she started the procedure. So she told me that I would feel a weird sensation. So for this part, when they put the electrical current on your cervix, I'm not sure if everyone, like the first couple of times she did it, I didn't really feel anything. It wasn't that bad. But towards the middle part, like maybe 10 or so minutes into it, I started to feel the burn. So like I said, not the worst pain in the world, but it's pretty bad. And I like to think I have a high tolerance for pain most times. So it was just like, if you can picture air, hot air blowing inside of you, so like all the way to the back of your vagina cavity. So it's just like hot air blowing, and it's kind of yeah, it's hot. So it can range from warm to hot. Some of them were hotter than others, and it's like that, and you can smell the burning, of course. So that was kind of uncomfortable, but you can kind of feel the air, I want to say, blowing into your cervix, your vagina area. And like I said, it was hot. Wasn't the worst pain in the world. Very uncomfortable. Very uncomfortable. There were some parts that kind of felt worse than others, I guess I can say. Some parts felt worse than others. And overall, so after she, you know, did the electrical current, she did the Leep procedure, she told me that she's done. But I'm not sure if this goes for everyone, but I was bleeding excessively. So she put a solution on my cervix and around my cervix to stop the bleeding or minimize the bleeding. And yeah, the procedure itself, after it was done, you know, she was cleaning everything out and wiping everything down. And, you know, I feel like after she takes the I forget what the name of it is, something with an S. But after she takes the tool out of your vagina, you feel a sense of relief. I know I did. It's like, wow, it's over. So what else happened? Yeah, so the procedure itself took about 35 minutes. We had to stop 2 times because she had to numb me up a little bit more as it was starting to burn. So yeah, so she numbed me up a little bit more. It took 35 minutes. For some, it may take less time depending on your tolerance for pain. And afterwards, she explained my discharge rules. Nothing inside of your vagina for 4 weeks. I think I'm gonna go 6 weeks just to make sure. So no intercourse, no tampons, no hot baths, because, you know, it's an open wound at this point. You know, you just had surgery to remove a piece of your cervix, so it's an open wound. Yeah, she told me that within 2 weeks or so, I'm gonna, after the scabs fall off, it's gonna be, I'm so sorry for the graphic detail, but I just want everybody to get enough information about it so you won't go into it like completely blindsided. So afterwards, she said around 2 weeks or so, the scabs will fall off and there will be excessive bleeding. Nothing to worry about. It's completely normal. And if it should only last a day or two. So if it gets a little out of hand, you can call your gynecologist and maybe they can prescribe you something. Or if you want to go into their office, maybe you can pay them a visit and see what's going on. But as far as the recovery, like I said, 4 to 6 weeks, nothing inside of your vagina. Give it time to heal. And pain medication, I know she prescribed me Percocet and ibuprofen, so I'll be taking that soon. As far as right now, like I said, I'm probably like 10-15 minutes post operation, if you want to say, and I feel a tingling sensation, so it's kind of tingling down there, kind of crampy, but not really crampy. It's kind of mild cramps. And I feel okay. I feel a little weak. I just want to go to sleep, honestly. But overall, on a scale 1 to 10, the Leep procedure, I would give it a pain scale from 1 to 10. I would say, for me personally, it was probably an 8. So maybe 7, but 8 on the higher end of the scale. So just keep that in mind. I don't want anybody to be discouraged. I would just encourage you to be calm throughout the procedure. Try to cloud your mind with other things other than what's going on at the current moment. That's what I did. You know, I was thinking about song lyrics or something else other than what was going on at the time, and that kind of helped me get through the procedure. Yeah, just go into it, get it done. It's not that long. It's only an instant of your life, you know, of your day. 24 hours in a day, and this procedure is what, 20 to 30 minutes. So I wish everyone good luck with their leaps, with their procedures, other procedures, biopsies, cone biopsies, all of that good stuff. I will definitely give everyone an update after I hit my 2-week mark. I have 2 weeks to follow up, and she's gonna discuss my pathology. So we're gonna speak about that, and maybe I'll upload a video then. And yeah, if you have any questions for me, just leave them in my comments. I'll be sure to answer anything. This is my first YouTube video, so hopefully I was able to help someone get over the anxiety of having their first Leep procedure. And yeah, God bless. I hope everything goes well, and I will talk to you all soon. And again, my name is Brianna. I don't know if I stated that already, but I'm Brianna, and I look forward to hearing what you all have to say.